Good morning, everyone. How are you? My name is Donna Lynch, and I'm with the Resource Center for Family Focused Practice, and you are here today for our Wraparound webinar, Elevating Wraparound Programs Through Continuous Quality Improvement, CQI. We are so excited to have Tyler Stickney here with us today. While everybody's getting in the room, resonated with their technology, getting on camera, making sure that they can hear me, I will change my name. That is so weird that I haven't done that already. So I already apologize. So good to see you. We'll be here together from 9 to 11 this morning. And we've got Tyler here to go ahead and present our Wraparound webinar this morning. It is 9:01. We're going to give 2 minutes for people to continue to enter the room. My name is Donna Lynch, and I will be facilitating the webinar this morning. So welcome. We're so happy to see you. Catherine Bainsmore, haven't seen you in 500 years. How are you? You look great. You look great. Awesome. Tiffany, how are you? Good morning. Loretta, how's it going? I see so many people I see in the sandbox all the time. And that's what I like to call it. We see each other in the sandbox because we play nice together with our toys. Good morning, everyone. My name is Donna Lynch, and I'm with the Resource Center for Family Focused Practice. You are here with us today for our Wraparound webinar, Elevating Wraparound Programs Through Continuous Quality Improvement, CQI. Data is so amazing, and we can do so many incredible things with data in Wraparound to help our youth and families for sustainability and just, true change, right? If we know what's happening with our youth families and our teams together. So I'm really excited today. 1 more minute, it's 9:02. We're gonna give everybody 1 quick second to come on into the room. In the meantime, if you could put your name, your role, your county, and something you're looking forward to this weekend in the chat. So Tyler can get an idea of who's in the room with him this morning. James is here. With our UC Davis team. He will be our proctor. So if you're having any technological difficulties, please lean into James or myself. We can both help you. During the webinar, Tyler will not be taking questions during the presentation. Absolutely, I will be capturing questions in the chat for you. So I will grab them and ask, or during the Q&A portion, you can either use the raise your hand feature, pop it in the chat, and we'll go through that at the end as well. We will be posting an evaluation at the end of today's webinar. So please, please, please stick around to fill that out. We do go through them. We do take your feedback, and we want to know how we can improve each webinar moving forward. With that, thank you all so much for being here. Today, we are with Tyler Stickney, Elevating Wraparound Programs Through Continuous Quality Improvement. Today is engaging and informative 2-hour webinar focused on continuous quality improvement and wraparound. Our goal is to explore strategies that enhance the quality and effectiveness of wraparound services, ensuring better outcomes for youth and families. This session is designed to empower program leaders, coordinators, and stakeholders with actionable CQI practices, including best practices in data collection, analysis, and implementation. Tyler will discuss practical steps to foster culture of CQI within organizations and help you drive into meaningful, lasting impact. Please note that counties and policies procedures may vary. We encourage you to consult your leadership for guidance on specific questions related to your organization's practices. With that, I am honored to have Tyler Stickney as our speaker today. Tyler is a software engineer committed to developing tools that improve lives. Before transitioning into software development, he worked extensively in social services field as a case manager, administrator for a short-term residential therapeutic program. Currently, Tyler serves as Director of Data and Outcomes for Olive Crest, a nonprofit organization providing wraparound, foster care, STRTP, and transitional housing, mental health services to youth in Southern California. His expertise lies in designing and implementing software systems that facilitate the identification, collection, retention, and analysis in human services data. In addition, his work in social services, Tyler has experience developing data systems in banking and real estate sectors. We are so excited to have him share his insights today. Tyler absolutely has made data understandable for me, and it sounds like Charlie Brown's teacher. So, all right, Tyler, welcome in.
Good
Thanks
morning,
for having,
everybody.
thanks for coming.
Yeah, thank you for the introduction, Danae. Really good to see everybody. I was scrolling through as everybody was coming in, and it's to me the most fun thing. We just hit over 100 people, which is insane. But it's always so much fun to have everyone throughout the state of California come together for anything like this. And so I just want to start by saying thank you so much for signing up today and spending a couple hours with us while we talk about CQI in Wraparound. And I'll go through a little list of learning goals that we have today, but I want to start us off and I'm going to share and I want to pose a question just to think about. And I want to pose this to everybody as we start off. And my question is, why are airplane crashes so rare? And I want you to think about that. And I also want you to think about why don't more skyscrapers collapse? So why are airplane crashes so rare? Why don't more skyscrapers collapse? An airplane, very, very complex piece of machinery. It takes a lot of people, a lot of things going right. I think every time I fly, it's absolutely insane that I'm up that high in the air. I think it's not natural. I think it's not normal. I don't know why I'm doing it, but every single time, it ends up being okay and everything comes together and it's almost perfect. And the same thing if I'm in a larger city and I'm, staying at a hotel or traveling, and then I'm in these huge buildings that as I'm in there, I'm thinking this shouldn't be possible. This feels wrong that I'm taking this elevator 10 stories, 20 stories, 30 stories, 50 stories, right? And it ends up being okay. And so if you think about plane crashes in the last 15 years, there's been 150 million commercial flights for the United States. 150 million commercial flights. There's been one commercial airline crash in the US in those last 15 years. When I first put together this presentation, the number was zero. Of course, there was the incident in Washington, D.C., which was just, you can't describe it any other way than shocking and a tragedy. But still one in the last 15 years, commercial flights. And so I'm not talking about small personal aircraft and things like that, but there's been one. And so we have, if we look at that, we have a 0.00000000007% chance of being involved in something like that. And so if we look at the industry behaviors in the commercial airline industry, especially in the United States, there's three things that kind of pop out at us, and that's their extensive training requirements. So to be a pilot takes a lot of years of training, of learning, of simulation, of practicing, of working under somebody else, of classroom learning. There's robust planning involved, and then there's checklists that they use. So if you think about a flight, you get on it and you sit down and the plane takes off and you get your, peanuts or whatever, and maybe a drink, and you're flying along. You get to your airport, you land, you get off. But during that time, the people who are doing air traffic control, they're going through a bunch of checklists. The pilots have a pre-flight checklist. They have a takeoff checklist. They have a cruising checklist. They have a deviation checklist. They have a landing checklist. They have about 40 different checklists for when emergencies come up. So they're flying along and an engine goes out. They have a checklist for that. And they have training behind what to do with that. If they have a landing gear issue, there's a checklist for that, and there's training behind that. And so those are some of the industry practices that gets us to that extremely, like almost perfection in terms of the ability to fly commercial airlines in the United States, right? Um, let's switch over a little bit and talk about why don't more skyscrapers collapse? They're extremely complex structures that go into it. But if we go back 15 years, there's about an estimated 25,000 in the US, 25,000 high rises. So we'll define that as anything more than 10 stories. There's been one collapse. So same thing, one incident in the last 15 years. And that was in 2021 in Florida. There was that condominium that fell, which again was an extreme tragedy. It made world news when it happened. But if we look at that, there's a 0.000004% chance that a building would collapse within 15 years. And you wonder how that is because, again, extremely complicated structures. There's electrical, there's plumbing, there's heating, air conditioning, there's elevators moving around, things break. You can have the floor break in, a story that's 25 floors up. You can have window repairs happening. You can have fires. But again, we look at it and we continue to see that it's almost perfection. Again, the industry behaviors that you see are almost exactly the same thing, which is extensive training requirements. So the people who are engineering these buildings and designing these buildings, they go to school for a long time. They have to get certified. They have to get licensed. They have to have ongoing continuing education. There's specialties involved. The people building it, the same thing. The construction crew is going through training. There's specialties involved. There's the person who's, specializing in the electronics, the foundation, the walls, the moving parts, everything like that. There's robust planning that goes into place. They're not just winging it, but there's a whole set of plans that's very, very robust. And as they're building that building, things come up and they adjust and they go to these fallback, these contingency plans, right? And then they have checklists. So there's a design checklist from the architecture, and there's the structural engineers checklist, and there's the different licensing and approval requirements that exist as a checklist. And while they're building it every single layer up, they're executing these checklists to make sure that they achieve what's almost perfection, because it matters to them. So if we think back to the flight, every single person on that flight, it really, really matters to you if you're on an airplane that everybody's getting things right for the things that matter, right? And if you're in a building and you live in a especially a large high rise or something like that, or you're visiting, you're staying in a hotel, it really, really matters to you that everybody involved in that process got it right every single time. And so if we think about it, is wraparound any different? Do we think about wraparound differently? We're working with kids and families with complex needs, but is it this distinct thing where we say, yeah, high rises and commercial airlines in the United States, that matters, but wraparound, that's a different thing. We can't we can't have the same level of quality in wraparound. And I think sometimes we often do think about it differently. But what I'm posing for you all today is that we put this in the same category and we think about what if we treated wraparound quality like we treated commercial buildings and flights? So I'll say it again. What if we treated wraparound quality like we treat commercial buildings and flights, where our mindset is let's try to get it right. Not even let's try to get it right. Let's get it right 100% of the time because what we're doing really, really matters. And for the people who are getting the wraparound and participating in wraparound, they're really a lot of times at kind of the worst time in their lives. And the idea is it's only going to get better from here. The idea is we come in and we work with these families who every single one's going to be different. Um, Usually they're going to have very, very complex needs. It's not an easy situation that they're in, but we have the opportunity to really deliver something that has been shown to be so life-changing. And you're changing someone's life. If you're working with a 7-year-old or even a 15-year-old, you're changing their life potentially for 6, 7, 8 decades. Their whole life could be different for the next 6, 7, or 8 decades, right? And so it does matter. And so that's kind of going to be the theme of today, which is CQI and wraparound. And I'm just super excited about this topic. And so I kind of want to walk you through some learning objectives that I want to go through today. And The first one is I'd like us all to understand the basics of general continuous quality improvement approaches. And I want to give just the basic framework for it. There's specific programs you can implement. There's Lean, there's Six Sigma, there's all kinds of different things. But we want to just cover the basics of what CQI actually means, because a lot of people confuse CQI with quality control or quality assurance, and it's not quite the same thing. I want us to appreciate the importance CQI plays in family outcomes. Why is it so important that we implement a CQI process? I'm going to teach you guys two strategies that you can incorporate to improve outcomes. So we're going to be taking two of those things. We talked about skyscrapers. We talked about commercial airlines in the U.S. And so two of those things, training and checklists, I like them because they're so simple. Uh, and I like talking about them because it's easy to get them wrong. And so I'm going to talk about how you can have a very systematic approach to data collection and actual strategy execution related to training and checklists. And then we're going to talk about some specific strategies. So we're going to implement those strategies into CANS assessments, and we're going to talk about how you can implement them into engagement, and we're going to talk about how you can implement them into fidelity measures. So it's going to be a fun morning, I hope. So if you have questions as we're kind of going through, I don't see the chat, but I'll put it over here. And I know Danae is diligently tracking the chat, and we'll be able to come back for any questions. Okay. All right. So let's kind of talk about the initial thing, which of course is we can't really talk about CQI without talking about what is CQI. And so CQI stands for continuous quality improvement. The continuous aspect of it is what everybody gets wrong. They get it wrong because they say, hey, we're going to do a CQI. And you spend 2 months doing a CQI, and then you check it off your list and you say, we're done. We did a CQI. We did a quality improvement project, whatever you're going to call it. Sometimes people don't call it CQI. And they say, we're done. Well, you've missed the continuous part, because it's an ongoing process that repeats, it never finishes, and it should be part of a long-term strategy. So saying that I'm done with CQI is like saying as a business, hey, we went and we did this payroll thing, and now we're done and we don't have to think about payroll anymore, right? Yes, you do. You absolutely have to continue thinking about payroll, because payroll comes every month or twice a month or every 2 weeks or however you do it. It never ends. Uh, it's part of your ongoing strategy that you're going to execute. It's part of your ongoing budget. It's part of everything. It does not end. It is not a one and done with CQI. Very, very important. The quality piece, so continuous quality, the quality in CQI, you're trying to look at effectiveness, efficiency, equitability. You're looking at the characteristics of what you're doing, and that can be quantitative, it can be qualitative, it can be whether or not something's even happening, or it could be the degree to what it's happening, right? So if you're doing a continuous quality improvement, let's say you transport children, and so you want to put a CQI process in for driving safety, because maybe every couple of years there's an employee who gets in an accident and they're with a child. And so the quality of that would be the safety of the driving, right? And so we could talk more about that, but what would go into that is, well, what practices drive that ultimate quality of safety? Safety being defined as the absence of car accidents, especially with children that we're transporting. And then the third thing is the improvement. It's getting better. And so continuous quality improvement, it's this ongoing process. It repeats, it never finishes. It's a long-term strategy. You're looking at making better the efficiency, the equitability, the effectiveness, the frequency, whatever it is, you're improving it over time. So you're kind of in it for the long game with CQI. So the general CQI approach that I'll share. And unfortunately, in 2 hours, we can't get through all of this in depth, but I just want to give you the overview, and we're going to kind of narrow ourselves into one area. But the general approach, which if you guys know or have worked with Annabelle Godoy, her and I have this 4-week series where we really drill down into the CQI approach in terms of implementation, but we're kind of taking a little bit of a generalized approach here since we only have 2 hours together. But the general CQI approach is you need to select an outcome measure, and an outcome measure is just the end result of what you want to see. So the I was just talking about transporting children. The number of car accidents would be an outcome measure. Is it 1 every 5 years? Is it 10 every 5 years? Is it 1 a year? Is it 1 a month? But that's the rate would be that. If you're looking at something like a fidelity measure, University of Washington has several fidelity measures, which measures how closely to the wraparound model are you operating at? Are you actually implementing the true wraparound model? So the examples of those measures would be uh, the WIFI, Wraparound Fidelity Index, the TOM, the Team Observation Measure, the DART, the Document Assessment and Review Tool. So they can measure things like, are you actually implementing effective teamwork? Or do you have timely engagement? Are there natural supports included? All of those things are outcome measures that you can measure. So you would select one, you'd establish your baseline. So where are we at right now? A lot of people miss this one too, but you have to establish your baseline. How many of our kids that we work with or the families that we work with, how many of them actually have natural supports? How many of our child and family team meetings are we actually allowing everyone to participate in? How many of our child and family team meetings actually have the full child and family team present? How many times when we get a referral for a new youth, how often are we engaging with them in a timely manner where we're establishing we're meeting them, first of all, and then we're establishing a safety plan and a plan of care within a timeline that is more effective? Or how often are you doing that way down the line, right? So that would be establishing your baseline. Where are you at today? You're going to set a target, which is where do you want to be. So you have your outcome measure, let's say inclusion of natural supports. Where are we at? Let's say 50% of our youth that we've worked with in the last year, we actually had true, verifiable, real, natural supports by the time we get to discharge, let's say. And so you want to say, well, we think 50% is low. Ideally, it would be 100%, but we're going to say, let's try to get it to 60%. So let's increase by 10%. That would be setting a target. You're going to identify interventions. Excuse me. You're going to identify interventions. So how do we go from 50% to 60%? A lot of times, a lot of teams will say, ooh, we want to get to 60%. Let's do it. Let's be motivated. Everyone's motivated, but there's no plan in place, right? It'd be like it'd be like holding a child and family team meeting. And yeah, everybody knows, okay, yeah, we want to get to the point where we can have a family dinner together and it doesn't result in shouting and somebody, leaving in tears. That's my dream. That's my vision for my family, to just be able to have family dinner together and it's fun. Well, that's not enough. You have to say, well, how do we get to that point, right? So if you're working with families and wraparound, it's kind of the obvious thing, right? How do we get to that point? What is the actual strategies that we get to that point? It's the same thing with CQI. Just wanting it is of course not going to be enough. You have to say, well, if we're going to include natural supports, how are we going to do that? Are we going to, do we have a workforce that understands natural supports, that knows how to connect families with natural supports? What are our procedures? What are our agendas look like? What do our one-on-ones look like with families so that we can actually make that happen? Where do we need to do that? So today we're going to be focusing on these interventions today. The interventions is just one part of 6 of these things, but we're going to kind of focus on the interventions today with CQI. The third thing is you actually have to execute those interventions. If any of you came to our 4-week series on Wraparound CQI, you would have been tired of hearing this from me already, because I always tell people this is where it all falls apart. Everybody is really good at coming up with plans, and typically we're very, very bad at seeing those plans through. And so it's a good plan, but we just never did it, right? So you implement a new process at intake, right? And during that engagement phase of wraparound, you implement a new process. related to identifying natural supports. And I'm saying natural supports as my example. I use that all the time because if you look at national means on wraparound fidelity, it's the inclusion of natural supports that's the lowest. It's the one people have the hardest time with because it is hard. It is hard. Uh, but so you have these new things. You say, okay, at intake, we're going to go in and we're going to ask these questions, and we have this whole worksheet. And it's a really good plan for identifying natural supports and actually bringing them into the child and family team, right? And then nobody does it. That happens organization to organization, agency to agency. It's like you could almost set your watch by it. It's almost like this universal rule where the execution just doesn't happen if you're not paying attention and actually measuring the execution. So you have to execute the interventions for it to work. And then the last thing is you review the results, and then you cycle back and you start all over again. So you look at the results. It's not going to be perfect, and you say, hey, our inclusion of natural supports did increase to 60%, from 50% to 60%. Okay, that's great. Now let's get it to 70%. Or you might say, hey, it didn't change. What happened? And there's frameworks for going back and doing a retrospective and saying, well, what point did we fail here? And where do we need to adjust so that this next CQI cycle that we do, typically 30 days or 60 days, depending on what you're measuring, or quarterly, this next one that we do, we're going to do it a little bit different so we get better. And eventually you get better at getting better. So that would be reviewing the results. Um, and then you rinse and repeat, right? So that's the general CQI approach. I'll tell you just a brief modern history because I think it's pretty fascinating. Brief modern history of CQI in the United States. 1940s, these two guys, Deming and Jurin, they kind of came out with the statistical process controls in manufacturing. So CQI was a pure manufacturing industry driven thing. They talked about quality planning, quality improvement, quality control. That was in the 1940s. Again, you're thinking of a lot of more industrialization, especially in the US in the 1940s and everything that was going on in that time. In the 1950s, Japan actually picked up the idea and they ran with it more than the US did. And so over in Toyota, again, same thing, manufacturing, they kind of approached this concept of total quality management or TQM. You sometimes hear it today, it's a little outdated, but some places are still using TQM. And again, they're putting these manufacturing quality principles into all aspects of the business operation. So they're saying, well, it works for manufacturing. What if we say payroll? What if we say training? What if we say sales? We do CQI with sales. And so that would be TQM. Toyota was the first major business to actually start running with that over in Japan. In the 80s, it came back to the United States. Again, everyone was interested in business competitiveness. It got formulated into an actual international standard. International Standard 9000 is what it's called. But there's a list of different types of quality management in international standards now. Then 1990s, we're getting a little close to modern history. You got these published frameworks that got released. So Lean and Six Sigma. Again, we're still primarily thinking about manufacturing sectors, even in the 1990s and 2000s. So again, we're thinking, how do we be efficient? How do we eliminate waste? How do we reduce defects in our assembly lines and things like that? It actually wasn't until the 2010s, which really wasn't that long ago, that you saw CQI expand into the healthcare sector. So surgeries, hospitals, medical field, where they said, well, what if we implement CQI? We take what was happening in manufacturing and we actually put that into patient outcomes, or we look at patient satisfaction. Nobody really cared about patient satisfaction systematically. I mean, there's always going to be doctors who cared about the patient satisfaction, but systematically as a program, that's when we started seeing this being implemented in just the 2010s. And now, this is like honestly brand new. The term CQI has been thrown around a lot, but now in behavioral health and child welfare, that's where you're seeing a really big retrospective look at behavioral health and child welfare, especially, and looking at CQI in the areas of, well, how do we use this to improve child and family long-term outcomes? How do we increase collaboration with our system of care partners? How do we have stakeholder satisfaction? How do we improve equity, right? All of these things is now just coming out. Again, there's a lot of departments that have been around a long time and they call themselves CQI. They're more quality assurance or compliance. And quality assurance and compliance is not the same thing as CQI, which is what I showed you on the last slide, where it's You're systematically looking at the quality of what you're doing. You're trying to improve it over time. You're measuring it. And if you continue doing it in that way, this is exactly what the United States commercial airlines did because people are terrified of flying. There's nothing you can do to make people not terrified of flying. Well, they do that because otherwise people would never get on an airplane. So they've achieved near perfection. It did not happen overnight, over and over and over these CQI cycles. So we're kind of at the beginning point of CQI in behavioral health and child welfare. And so why does CQI matter in wraparound? Uh, you know, I'll tell you why for me it matters. There's going to be people who have budget considerations and efficiency and things like that. To me, CQI matters in wraparound because all of these people that I'm showing you on my screen, this is who we work with in wraparound, and all of them matter so, so much. All of these kids that we just have, to me, the privilege of working with, they're hurting, things aren't going well, they're on a trajectory that is, you know, honestly not living to their full potential and their best life. And so it matters because, like I said earlier, we actually have the opportunity to come in and work with these families. So these kids and their, you know, their caregivers or their foster parents or whoever's taking care of them. And we have the opportunity to do something that really matters. But it's similar to if you're administering CPR or first aid. If you're the one administering CPR or first aid to somebody, they're not getting it from somebody else. They're getting it from you. And so that's why there's this concept of, well, you can't stop because you've prevented them from getting help from anybody else because you've stepped in. And so the other help is kind of standing back, right? And it's the same thing in wraparound. Oftentimes, they get enrolled in wraparound and you and your agency and everyone that you work with, right? Wraparound's not just one person, but that's the help that they're getting right now. And so to me, do an excellent job with that. Provide and conduct the wraparound services with just ultimate excellence because again, it's not about today or tomorrow. You're thinking about how are these kids' lives going to be now in their 20s, right? Their 20s can be really, really bad. Their 20s can be really, really good. Their 30s can be really, really bad. Their 30s could be really, really good. And we have the opportunity to change that. So imagine for a second, your surgeon comes up and they tell you, I haven't been trained. All of our confidence is gone. In fact, this wouldn't happen because you would say, no, we're not, we're not doing that. If somebody tells me I haven't been trained, we would say that's unacceptable. I'll pass. I'm not having the surgery. I'd rather not have it than you coming up to me and saying I haven't been trained. We hear that sometimes in behavioral health. We hear that sometimes in child welfare. We hear that sometimes in probation. You have some construction workers, and this guy says, you got the blueprints ready to review? And he says, no, no blueprints. We're going to wing it, right? No blueprints. We're going to wing it. Imagine, would you live in that building? Would you live in a building if the construction crew who built it said, nah, we had an architect and we had a structural engineer and we had a lot of people do the planning process and the plans got approved and it went through revisions for safety and all of these things were in place. But what we're going to do is we're going to wing it. People might not say that in social services or human services. Sometimes they're not going to say we're going to wing it, but oftentimes we do. And I'll tell you, I'll just tell you, have I said this? Well, I haven't been trained, but here we go. Or my team, I used to supervise a team working with kids. Yeah, we haven't been trained, but we don't have enough people. So let's figure out what happens. I've done it. Have I ever said, yeah, we're going to wing it? Yes, I have. Were the results good? No, they were not. What if you're getting on this airplane and this guy says, hey, did you do the pre-flight check? And this guy says, nah, let's skip it today. Let's not check to make sure we have enough gas in the tank. let's not check the landing gears and all the electronics and the safety systems and the oxygen. Let's not do all the things we're supposed to be. By the way, that book in front of him, those are the checklists. If you see this book right here, this is called a flight checklist. It's insanely big. The way they do it is it's actually very quickly to find any of these checklists here. So they can find it very, very, very quickly, especially in an emergency. But, would you, if you heard pilots saying this, hey, did you do the pre-flight checklist? And they said, no, we're going to skip it today. I would turn around. If it was me, because I don't like being on a plane anyway, if it was me, I would turn around and I would get off the plane. I would say, absolutely not. I don't care where I have to be. It could be the biggest opportunity in the world. It could be a job interview. And I wouldn't do it. I would say I'd rather actually not fly than for you to skip corners. And so what I'm saying today is, what if we had the same mindset with Wraparound, where we said it is so important to get it right every single time. So let's not say, yeah, let's skip the checklist and wing it. Let's actually do it. So another thing, successful cases, we have, and here's the reality that is in this field that we work in. We're going to have successful cases. We're going to have unsuccessful cases. We're going to have them, that's kind of a black and white thinking. We're going to have them kind of in between. The successful cases, though, I'll tell you, if you've worked with a kid, and a lot of you in this training know what I'm talking about, if you've worked with a kid through the ups and the downs, there is no better feeling than when they can graduate that program or they accomplish even something small. It is like it's like your own kid did something amazing. Like I can't even describe how happy it is. And we say for the successful cases, we say great work team and job well done, and we celebrate the kid because they did most of the work, and we celebrate each other and we say, wow, this is great. If we're an agency that has high success, let's say you're a wraparound program and 95% of the youth you work with complete their treatment goals or their plan of care goals or their underlying needs are met and managed, and you're developing self-sufficiency and you've successfully have a transition plan and they've transitioned out of wraparound successfully. And let's say that's 98% of all your kids. You're going to tell yourself, great job, team, job well done. We're a great provider of wraparound services. On the flip side of that, I'll tell you, again, having worked with kids, there's no worse feeling. There's been times I've worked with a kid for 2 years. 2 years I've worked with him and gets arrested or runs away, or something happens where the work has to end and it's not in the way that we would want. Or you're not seeing the results. You're continuing to work with someone. I used to work with a lot of teenage males who had pretty severe drug addictions, and that's a journey in itself, right? But some of them it was really hard to see progress with, and as good as it feels when things are successful, it feels really bad. Here's what I hear a lot, and I've said this to myself. Here's what I hear a lot. The family wasn't ready to change. There was nothing we could do. Well, someone can't change unless they want to change. True, by the way, true. They weren't ready. They didn't want the services. Um, so this happens a lot. I see it, and it's not everyone, but I see it, and it's not one organization or agency. I've worked with probably 6 or 7 different organizations and agencies. I always see it where the successful ones, you say, wow, we did a great job. The kid did a great job. If it's unsuccessful, well, yeah, we really couldn't, that was kind of doomed from the beginning. It was impossible for it to happen. They didn't want to change. So, nothing we could do about it, right? I want to change people's mindsets because, again, some of that could be true. If we change the mindset for the successful cases, what did we do that worked? And definitely still celebrate it. You should celebrate successes. But the thing that's hard, and I promise you that it's hard, is for the unsuccessful cases afterwards to say, where did we fail? We, us as the professionals who are being paid to do this, because we're happy to get paid to do this. Where did we fail? And it's really hard because you don't want to demoralize your team. And your team that you're working with, especially if you're in a leadership role, they're going to feel it already. They're going to not be happy that you had a case that you were trying so hard with and then it ended unsuccessfully. But I would suggest when a case starts to say, hey, we have Johnny. Johnny's going to be getting wraparound services. Let's talk about this. Here's his referral information. Let's get this scheduled, all those things. If you're in a leadership role, I think one of the things that is effective and that you can do is say, hey, no matter what happens, I really want this case to be successful. I want us to get Johnny and his family the best wraparound services, and I want to improve their lives for the next 8 decades, right? However, when this case closes, let's all be prepared to talk about what went well. And if this case closes unsuccessfully, let's talk about what didn't go well as a retrospective and just front load it like that, right? But it's really, really important because you do learn a lot from when you fail. In fact, I would say you probably learn if I look back through my professional career so far, the times where it's been a crash and burn and I've been humiliated, I've been embarrassed, I've failed miserably, I've had a very expensive mistake, all of those things that have happened to me, I've learned the most from it. So don't let an unsuccessful case go by the wayside and not learn anything from it, is what I would say. So again, here's our doctor again. If our doctor says, hey, if your surgery isn't successful today, it's because we don't have enough staff. That would never happen. The hospitals have taken the approach to say, okay, if there's not enough staff, we're not doing it. And by the way, with especially in the United States, definitely in the United States, I should have put up the statistics for surgeries. It's almost perfection. You hear there's just a lot of surgeries. You hear about, things happening. It's almost perfection, and they're so good and they're so safe, and they're doing. And by the way, this is in the last couple decades, they've implemented checklists. Hey, here's our pre-surgery checklist. We're going to do all these things. They do it. They make sure it happens. During surgery, we have all these contingencies. If this happens, we're going to do this. If that happens, we're going to do this. And they're well prepared. They have those checklists. They're well trained, right? To be a doctor takes, I don't know, what, 20 years or something. And you wouldn't hear that. And if you did hear that, you would be shocked, right? So, general approach, we're talking about identifying interventions right here. All right, identifying interventions. What are you going to do to get to that target? I'm going to talk about two today. And the first thing is training. And the reason I like to talk about training, and here's a little quote for you. Workplace training is that special time when everyone nods like they understand, and then immediately they ask their coworker what to do, right? We want to avoid that. So training in and of itself, to me, I put that like spending money. A lot of times you hear people say, hey, we're going to fix education. We're spending $100 million on education. So that's my commitment to education. Or, hey, we're going to fix the roads. We're going to invest, $40 million in Los Angeles roads to fix it. Or we're going to invest money, over here to improve it. Investing the money is you need the money, right? You need resources to operate, but it's how you spend that money. And it's the same thing with training, right? So you can invest money in anything. If you invest $100 million in education and you use it to buy pencils, okay, you have $100 million in pencils, but that's not going to change the underlying issues that may have been affecting student outcomes. You could be an agency and you get a grant for wraparound and you get, $500,000 for training. Well, it's how you actually do that training that's going to matter. Because if you're just winging it with the training, it's not going to be that good and you're not going to really get that result. So one framework that I wanted to share with everybody today, and it's a training framework that you can use as an intervention. So if you say, hey, we have low inclusion of natural supports, or hey, we've realized in our child and family team meetings, we don't have effective teamwork. In fact, when we survey people, they say, well, the facilitator or the care coordinator or the case manager, they're just kind of lecturing to us is kind of how it's working. You say, well, that's not really wraparound, right? So let's change that. Let's do some training. So training is often an immediate reaction to fixing a problem, but a lot of times it's done without intention. And so this framework I'm going to go over with you guys today, it's called the Kirkpatrick training model. Maybe some of you have heard about it. They have copyrighted material that you can purchase, but the general concept you can implement on your own. You don't need to purchase it. But the general concept is you establish your desired results. Let's say my desired result, I want to decrease accidents while transporting clients or transporting kids in wraparound. or I want to increase natural supports or effective teamwork or follow through on action items. Hey, we've noticed on all our plans of care, we do all these action items and nobody ever gets them done. Our staff doesn't get them done. The kids don't get them done. The parents don't get them done. They're just kind of there for decoration on our plan of care. Maybe that's your desired result. And so then there's four things that you do and you measure. You do your training and you design your training, do a good training. But the first thing you want to do on a systematically and with data, by the way, you're not just saying you're doing this, you're actually collecting data on this. You're going to measure when you do your training, you're going to measure the participants' reaction to it. So you're going to look and you're going to say, what was their reaction? I'm going to dig into each of these individually in a second. And then you're going to measure the learning. And then you're going to measure the behavior. And then you're going to measure the results. And so that's the Kirkpatrick training model, where you're taking a data-driven approach to all of these things because you're wanting to affect change within your wraparound program. You're measuring these at these four levels. You're going to learn a lot, and you're going to be able to figure out exactly what's not working. So let me kind of dig into these things really quick for you. Establishing the desired results, you're asking yourself, what are you hoping will change, right? Is your meeting cancellation decreasing? Are you hoping the family's declining wraparound services is going to be decreasing? So maybe you have at engagement a lot of people saying, nah, wraparound's not for me. No, thank you. Wait, you said optional? Oh, if it's optional, no, I don't want it, right? Maybe follow through on action items. We talked about that. Maybe fidelity scores. Maybe there's a certain fidelity score. Maybe you're measuring fidelity with surveys or team observations or document reviews, and you have scores that are lower than you'd like. So what is it you're hoping you're going to change? So establish that up front and know that up front. Then what you're going to do is you're going to measure the reaction. So you're going to conduct your training and you're asking yourself, how did staff respond to this training? How did they respond? Happy, sleepy, surprised, sad? Did they find it useful? Did people find the training useful, or were they sitting there and thinking, why am I here? What does this have to do with me? Was it interesting? Was the training interesting? Well, why does that matter? If it's not interesting, people won't retain anything, I promise you. It's going to be, Donna was talking earlier about the Charlie Brown, teacher, want. I've been in a lot of those trainings, which I call like snoozers. And I'm sitting there looking at the clock, counting down to when I can leave, right? Or if it's an in-person, I get one of those fake phone calls and maybe I don't come back, right? It's got to be interesting. Was it applicable? Did people say, oh, okay, I could see how I could do this, right? Were they like, yeah, okay, that's very theoretical. I don't know how I can apply that. Was it understandable? Know your audience. So you're measuring, and by the way, these questions, you're actually measuring these things. I'll tell you in a second how to do it, but was it understandable? Do you have brand new staff and you're talking at this super high level about the nuances and what's an underlying need and what's the model of change, and you're talking about these very high level things and they don't even know what wraparound is. They just know they signed up because they want to work with kids, and you're talking about these very high level things that they don't have the foundation to understand that. So was it understandable? So again, you could do a post-training survey. So you're asking people, did you like the training? By the way, UC Davis, after this training, they're going to measure reaction. That's one of the things they're going to measure. You're going to get some type of survey, most likely. And, did you find it useful or something like that, right? So what's your reaction to it? But you could do a post-training survey. Do it immediately. Don't do it a week later. Say, hey, if it's in person, there's donuts and coffee in the back. Before you grab those, complete a survey or something like that, right? You could do a follow-up from the supervisor. So you could have, people's supervisor, maybe they meet with them one-on-one and they say, hey, how was that training? Did you like it? But make it structured so that everyone's asking the same questions so that you can analyze the data. You could do a discussion session after the training, right? Have someone else do it. If after this training, I closed my PowerPoint and I said, hey, did you guys all think I did a good job? We're all nice. We're in human services. Everyone's going to say, yeah, you did great, Tyler. You did great, right? We want honest feedback. We want actual real information that's not because people feel nervous about being critical. So if you have a discussion session after the training to measure reaction, have somebody else facilitate that discussion. So you're going to measure that reaction, and pay attention to what you're seeing. And I'm going to give you an example coming up where we'll actually go through a hypothetical and some stuff that you might see. Then you're going to measure learning. So same thing right after that training, you're asking yourself, how much did staff actually retain? How much did they actually learn? And why does that matter? Well, I've been to a lot of trainings that were so much fun, and the instructor was like a comedian, and I was laughing and I was crying, and I felt like it was a Vegas production. It was tons of fun. I've been to those trainings. I love them. Um, some of them I don't learn anything. They're fun, but I don't learn anything. So so the reaction is good. So reaction, great reaction. Not so good learning, maybe. By the way, rarely, if ever, is it the other way around. If there's not a good reaction, you're almost never going to have learning. So if reaction is bad, fix that, because you're not going to have it like the opposite where it's like, well, we hated that training, but man, we learned a lot and I'm going to remember it. Usually not. You usually have to have high satisfaction, high interest, high applicability, high understanding as the reaction, and then the learning, the retention is going to be better. Did they understand the material? Did they retain it? Are they equipped to use it? You could do a pre-test, post-test. So let's say you're training on, I don't know, driving safety. Let's say you're training on safety planning, how to develop a safety plan. Test them ahead of time, test them after, and see if they've learned something. You can measure that, measure it and document it. You could do follow-up from the supervisor. You could do a discussion session after the training as well. So same things, but do it immediately. Another good thing is do one immediately. And then if you want to measure retention a little bit better, do one 3 weeks later, do one maybe 3 months later, and see how people are, if it's been retained, right? So you definitely need to measure learning. Again, if learning's not there, this one, behavior. So the third thing you're going to do is you're going to actually measure behavior, because you're doing a training because you need people to do something differently. And there are some trainings which I call not necessarily trainings, I call them like in services or something, where you go and you talk about, hey, we have somebody coming out and they're talking about, you know, their program and the history of Wraparound or something like that. And maybe there's no behavioral changes. That's less common. Usually you're doing training because you want people to do something differently. You want people to start doing something they weren't doing. You want people to stop doing something they were doing. You want people to do the same thing but differently, more of it, less of it, things like that. Um, so you're asking yourself now, is the training material being implemented? Because that's important. And by the way, our last step, if people didn't learn it and they didn't retain it and they didn't understand it, this is going to fail. So you have to have good learning, because you can't implement something that you don't even understand or you haven't retained. But is it now being implemented? Are the new skills actually being used? You train people. Here's how you can do an amazing safety plan. Hey, here's a transition planning framework that allows the family to be really successful and titrate down from wraparound and be self-sufficient. And everybody learns it, but nobody does it. That's what this is answering. Are people still confused on what to do? Maybe they understand the concepts, but in terms of putting it into practice, everyone's like, there's been so many times I've seen where something gets rolled out and then everyone's like, oh, I didn't think we were doing that yet, right? So are people still confused on what to do? Are people still confused on if they're doing it? Are new procedures actually happening? Are new procedures actually happening? How do you measure it? You have to measure it. Most people don't. This is what I see a lot of people get wrong. They don't measure this. They assume it's happening, and the assumption is usually wrong. So you have to measure it, right? How do you measure it? Self-reports. So you can ask people, hey, have you implemented this new transition planning approach that we talked about? Oh, yes, I have. Okay, well, how did it go? Talk to me about it, right? So maybe the supervisor's doing this. You can do observations. So observations are going to tell you that as well. You can also look at it through the documentation. So self-reports, you can observe a child and family team meeting, especially if you're doing something like like a team observation measure. You can actually, um, have somebody go and observe, or you can look at their documentation. Any of us working here, we always say, oh, if it wasn't written down, it didn't happen. Kind of true. So if you're doing those things, if you're implementing um, driving safety, if you're implementing engagement, is it documented? So you can look to that to answer that question. Fourth thing, measure the actual results. So you're asking yourself, what you wanted to change, did that actually change? Right? Did it actually? Because you're basing it off the assumption that if we do this training and they do these behaviors, that we're gonna see XYZ in our result, right? Well, again, that's an assumption. You have to measure it. So are the cancellations decreasing? If that's what your training was about. If your training was about how do you decrease cancellations, are they actually, people are doing these things, are they actually decreasing? Are less families declining services? Is there more follow through on action items? Whatever it is that you want to change, has fidelity improved? Are those things actually changing? Measure it. You should have a baseline, measure your new one, and then you can look at it. And then what you're going to do is you're going to review, because again, if people aren't doing those behaviors in step 3, step 4, when you measure it, you're probably not going to get the results because people are it's just business as usual. And so the reason this is such a good CQI intervention is because you can implement it, and it's harder than just going and doing a training, right? It's harder, but it's a million times better, because what's going to happen is you're going to implement this and you're going to know exactly the failure point, because it's not going to be perfect the first time. And you're going to say, hey, everyone loved the training, everyone understood it, but then nobody did the things that we talked about. So let's go back again. It's CQI. So we reset the cycle. Let's go back again and say, okay, do we need to do the training again? I don't think we need to do it because the learning wasn't the issue. Okay, well, what was the issue? Oh, well, the issue was people weren't implementing it. Okay, well, why not? Oh, well, we didn't really require anybody to document and nobody was following up on it. And so that's your failure point, right, in the process. So now you can hone in exactly, exactly what conversations need to happen instead of guessing and saying, I don't know why we're not getting the results we want in our wraparound program. So that's generally the Kirkpatrick model. Oh, has safety improved? Has compliance improved? Those are two other questions, right? Anything you want to change, did it actually happen? Let's go through a brief example of this. Again, you're establishing your desired results. I should have put on here, you actually do the training. That comes before step 1. So after you establish your desired results, determine that before you do your training, because you need to develop your training material. If you're training your workforce, your staff, you need to develop it with that goal in mind. What are we actually wanting to happen, right? So here's the Kirkpatrick model. Let's walk through it. So let's say you say your desired results. I want less families to decline wraparound within 30 days of referral. So let's say you're seeing within 30 days of referral, a lot of people are declining wraparound. They're saying thank you, but no thank you, right? You get to the house, it's one of these signs, and you get there, no soliciting, no trespassing. Um, depending on what area you're in, unexpected visitors will be shot at. I mean, we've all worked with all kinds of families, right? So, what if we're getting a lot of people saying, I don't want wraparound? I talked with they were not in California. This was an agency outside of California doing wraparound, but they had a decline rate of like 60 to 70%. 60 to 70% of the families that were referred to them said, I don't want wraparound, right? Which is, to me, it's very high. And so they thought, well, yeah, just people in general don't like wraparound. And I was telling them, no, that's you, right? You don't know how to sell it. So uh, what do what's your approach, right? Um, some organizations out there are very good and they have people are like, wow, I get wraparound. This is amazing. Yes, please, right? So let's say that's your desired results. How do we decrease the number of families declining wraparound? You're going to conduct your staff training. You do that. You're going to measure reaction. So your goal here is you measure participant satisfaction and perceived relevance of the training. That's your goal. That's what you're measuring. And so how do you do it? Post-training surveys. How useful was this training for your role? When it comes to surveys, my opinion is less is more. If you get more than 3 questions, everyone's going to hate you because we all hate surveys. So 3 questions max is my recommendation. Don't give someone, I know I'm a data nerd and there's a lot of fellow data nerds in this training, and the temptation is to be like, hey, let me give you this 45 item index to calculate your satisfaction with this training because I've covered all my bases and I've counterbalanced everything and I did a factor analysis and discrimination analysis on my items and it's like the 45 perfect items to ask people about a training. People are going to hate you and they're not going to do the survey, or they're going to do a down the street where they answer the survey all without reading the questions, right? So 3 questions max is my recommendation. You can do it how you want. So post training surveys, feedback forms with open-ended questions. Get that information. You can do short participant interviews or focus groups, kind of stuff we talked about. And again, this could be the response indicators that you might see. Maybe 80%, 85% of coordinators rate the training as useful or very useful. So maybe you did like a scale, like rate how useful it is. Maybe qualitatively, participants report feeling more confident in engaging new families. And maybe a common issue that you see is that some may feel the training was too theoretical or not relevant to real world situation, right? So they're talking about these published studies and you're talking about these theories and it's a little too high level and not practical. So maybe you get that, right? Listen to what people tell you. So if you're doing this training, sometimes the default reaction is like, well, why are they here if they don't want to learn the theory of what we're doing? Maybe true, but operating in theory and these high level discussions is a lot easier when you've been doing this a long time. When you're brand new, sometimes what you want to know is like, tell me what I need to do or tell me what I shouldn't do, right? So maybe that's something you see. So this would be an example of measuring reaction. Second thing, measuring learning. Your goal here, assess the knowledge gained and ability to apply new engagement strategies, right? So that you're trying to see, have they retained the ability to these new engagement strategies we talked about? Again, almost the same thing. Pre and post test training knowledge quizzes, role playing exercises. So maybe at the end of the training, you do role playing and you say, okay, I'm going to be a difficult family. You come up to me and tell me about why Wraparound is like the best thing since apple pie, right? Sell it to me. I'm a family that is going to be difficult, right? And you role play and you see if they're actually using those things and you measure it, right? You have somebody else saying, okay, yeah, they did these things, they didn't do these things. You do self-assessments on confidence. How confident are you that you can do this? Again, maybe you see, here's the data you collect. Maybe you see people score 30% higher on the post-training quiz about engagement techniques versus the pretest. Maybe 90% of the coordinators successfully demonstrate in the role playing new family engagement strategies and role playing scenarios. Again, you're documenting and you're recording this in terms of frequency, intensity, however you want to record it. It's up to you, but do it so you can analyze it over time. Common issue, maybe you see a common issue, some coordinators struggling with translating that theory into practice. So you know, okay, how do we do this better the next time we do this, right? You're going to measure behavior. So after the training now, you need to determine if there's actually improved engagement behaviors in the family interactions. So for these new families coming in, are people actually implementing the things that you went over in the training? And so how do you assess that? Well, your supervisor or peer observations of family interactions. So maybe the team goes out to meet and do their first face-to-face, and then afterwards you ask each other questions about each other and say, hey, did we do this? Did we do this? And mark it off, right? By the way, with self-assessments, be okay with self-assessment. Sometimes I talk to people and they're like, well, people might just lie. That's rare. Most people are not going to lie and falsify documentation and say, oh yeah, we did these things. Can it happen? Yes. People are going to say, yeah, we did these things and they really didn't. I have not found that happens with enough frequency where you have to worry and revert to like, well, how do we really know? Like, and you start becoming like a CIA agent trying to find the truth. Most people self-reports, they're going to say, I didn't do those things because in this case, the family had wraparound before. So when we got there, they knew all about it. So that's why we didn't do these things. Or we didn't do these things because in this situation, um, something culturally about the family, we decided to go a different direction or something like that, right? People are usually pretty honest. So don't worry about self-reports on data because usually it's pretty accurate, especially if it's something objective. Did this happen? Did it not happen? If it didn't happen, why, right? Mystery shopper style of feedback surveys. Um, so I'm getting a request for a little break.
Okay,
we're
keep
gonna go
going.
on through, but if you need to step away, absolutely. I think it's being recorded, so I think you can pick it up after. Okay. All right. So mystery shopper style family feedback surveys, send them a little survey and say, hey, we got a gift card for you. Welcome to Wraparound. We got a little gift card for you. And if you can answer these questions, you know, when your team came out to meet you for the first time, and you ask them questions about stuff that you would hope would be happening, right? Did they introduce themselves? Did they talk about what they can expect from Wraparound? Did they give you any materials? Were they friendly? Did you like them? You know, all of those types of things, right? Okay. Um, Tracking changes in initial family meeting attendance rates. You could track that. And the uh, response indicators, let's say 75% of coordinators or facilitators or case managers, whatever you call them, let's say you found that 75% consistently use these new engagement techniques. Maybe it was active listening, again, family strengths focus, explaining wraparound clearly. And the supervisors note 20% improvement in positive first impressions. And you're always going to see common issues. So maybe some coordinators or facilitators or case managers, they go back to old habits under stress or high caseloads. That is a very, very common thing that change is hard, especially behavioral changes that are different. So when you're busy, you go back to how you know. And maybe how you know was, hey, here's the packet. I'm going to come back in 2 weeks and come pick it up from you. Let me know if you have questions, right? Probably not very effective, but is it faster? Yes. So maybe people are defaulting back to old habits or saying, hey, instead of meeting in person, we're going to do a phone call. Or instead of doing a face-to-face where we can see each other, we're going to do a phone call, right? So measure that behavior. That's an example. And then the fourth thing, measuring your results. What would we do? Again, our goal, evaluate if the training led to measurable improvements in service acceptance. Did the training lead to measurable improvements in service acceptance? So let me, okay. So method of assessment, how do you measure that? Well, you look at family decline rates before and after the training. Did it actually get better? Did we see the things that we wanted to see, right? Assess overall family retention and wraparound services. You can analyze client satisfaction surveys related to these first interactions. There's a lot of ways you can measure it. And so some response indicators you might get, maybe family decline rates dropped from 35% to 20% within 6 months. That's amazing. Keep doing what you're doing, I would say, right? Maybe families report a higher level of trust in the initial meetings. Maybe more families actively engage in developing service plans. You could see a lot of different ways you can measure this, right? Maybe a common issue you see is external factors, right? So maybe there's a family crisis, or maybe there's misconceptions about services, and those things are still contributing to them declining services. You need to know that. So then when you train for this in the future or other interventions, right? Training is not always the answer to everything. I'm talking about this as an intervention. There's a lot of things you can do to improve the quality of your wraparound program that are not training based. But I'm talking about training because it's a very common thing that we think about, and this is just an amazing framework to use. So that would be measuring the results as an example here. Um, and so that's training, and it's not the end all be all, but if you do it this way, and I would encourage everyone, think about a training coming up and think about implementing it this way. Think about, okay, how would I measure people's reaction and come prepared to do that? Um, hey, how might I measure learning? And that can be hard sometimes, right? If you're talking about stuff that's very complex, how do I measure if they really understand um, how to identify underlying needs? Get creative, right? And figure that out. There's ways you can assess it, right? Especially if you're experienced. If you're experienced, you know if somebody understands something, right? Because they can explain it back to you. Um, Measuring, how do I know I wanted to increase people's ability, our facilitators or our care coordinators, I wanted to increase their skill sets on opening up participation in child and family team meetings? Or how do we get back on to the agenda when we go off on a tangent? And when do we know when it's okay not to get back on the agenda, right? All those types of things. How do you actually measure that? And then the results, what are you trying to get? So that's the Kirkpatrick model of training. And we're going to move right on into checklists. And here's my quote for checklists. It's turning I have too much to do into I have too much to do, but at least it's numbered. And I have this problem because I've never had checklists are different from to-do lists. I'll tell you that. My to-do lists, they never get shorter. They only get longer. And then I throw them away because I'm like, I'm not going to do any of that. So, but checklists, why checklists? They sound kind of bureaucratic. They sound kind of boring. They sound kind of institutional. Well, they ensure that the important things always happen. So as bureaucratic or institutional as checklist sounds, and again, I get it. It sounds the opposite of like interpersonal engagement with someone. Again, my pilot on the flight, I want him or her to ensure that the important things always happen. I want my doctor to ensure that the important things are always happening. I want the person who built my house, or if I'm living in an apartment, whoever built it, whoever designed it, whoever worked on it, I really want them to ensure that the important things happen. And if I'm getting wraparound services, again, this is kind of like, man, how's the rest of my life going to be? Let's ensure that the important things always happen because they are important. And I think everyone's in agreement with that. Like it is important what we're doing. I mean, we're working with people's lives. And so how do we ensure the important things always happen? It's checklists. Your program model, there's a lot of really good wraparound programs out there. It's worthless if it's not executed. You could have an amazing program model. You're going to submit that model. There's a lot of talk, with wraparound certification process, statewide certification, with CDSS and everything like that. Part of that is you're indicating, hey, this is how our program works. And by the way, there's a component of that which includes CQI, where you're describing your CQI processes. So very, very relevant to wraparound because it is a requirement to being certified as high fidelity wraparound in California, or will be a requirement, is having a formal CQI program within your wraparound program. But you could have an amazing model. If it's not executed, it's really not that amazing. Because on paper, it looks good, right? It looks good on paper. It's like hiring someone and their resume looks amazing and they're not so great in real life, right? They look good on paper, but it's not real. So your program model's worthless if it's not executed. Consistency between teams and staff, right? Do we have a consistent way that we're operating as an agency, as a department, as a program, as an organization? Checklists are really good when you're doing that, when you want that consistency. It's a record of important tasks being completed. Checklists should be actual checklists, right? They could be digital, they could be documentation, however you want to do it, but it should actually result in a record of these important things actually being completed. Because now you have due diligence shown. Yeah, when we got to when I first met this kid, we did look at are there acute safety concerns, right? Are there self-harm things we need to be aware of? Are there immediate things? And yeah, we're looking into those things and we've checked those and we've verified them. You now have documentation that happened. Also for new people, I'll tell you, excuse me, as a training tool for new employees, I think a lot of us don't appreciate how hard this work is and how hard it is to be new, especially when you've been doing it a long time and you just kind of, it's like the back of your hand just feels so natural. Think back to when you were new and you didn't even know what you didn't know. And there's all these acronyms and there's all these things you're supposed to do. And it's like, well, I thought this was the rule. And you're like, yeah, but we have to make an exception because the family, can't do this. And all of these things, I promise you, it's easy to forget how hard this work is, especially when you're new and you haven't done this type of work before. Checklists can be a great training tool for a new employee to gain some confidence, and at least they know these are the things I have to do. What is a checklist not? It's not going to allow you to engage with high quality with a kid. So if you're doing a one-on-one with a kid, maybe you're a behavioral health specialist, some type of youth partner, a checklist is not going to allow you to have meaningful engagement and connect with them. I mean, those are skills that are developed that are beyond a checklist, but it ensures that the important things actually happen, right? Are you actually having those meetings? Are you covering things and checking for things that have to be checked for? Those types of things are what checklists for. So it doesn't solve everything. I've found that the people, sometimes you have people who aren't, I don't know how to say this. They're not so great people. They like the checklist because they can, have something that's very quantitative. But there's more to that to being effective than just a checklist. So I'll throw that in there because you wouldn't go, if I was meeting you for a first time in your family, I wouldn't say, greet the family with a smile. Make sure you smile. Say hello and perhaps ask them about the weather. Okay, check. How is the weather, right? You're going to look like a robot. So, but the checklists are there to make sure the important things that have to happen are going to happen. High quality engagement with people involves more than just a checklist. Okay, we all know that. I'm going to give you an example. Let's say you're new staff and you're in wraparound, and I'm going to stop sharing for a second because I'm going to move this over here. So you're brand new in wraparound. It's your first day, and you say, "Hey, I've heard of these child and family team meetings. What are those things?" I say, "Oh, okay. Let me tell you. All right. So first, you're gonna get everyone together, the family, the kid, if appropriate, service providers, maybe a teacher, a coach, whoever's important in their life. You want a space that's comfortable, but not too chaotic. Start with introductions, let everybody say who they are, maybe share a fun fact if you're feeling ambitious. Then you jump into why you're all here, what's going on with the family, what's working, what's not. The family should talk first, or at least feel like they can talk first, but people have different opinions and that's okay. Just keep it respectful. At some point, you may need to make an actual plan. Who's doing what are the family strengths, what supports do they need? It's like pulling together a puzzle and pieces that sometimes don't fit right away. There might be some tangents, someone's venting about past services, another person brings up something totally unrelated, just roll with it, but guide it back when needed. By the end, everyone should know what they're responsible for. Make sure to follow because let's be real, people forget things. Set a next meeting date, make sure someone's taking notes because again, let's face it, no one remembers what's said an hour later, and hope that the plan actually helps. Okay, you're brand new and someone just described that to you. That felt, it wasn't wraparound I was working with, but when I was new, it felt like that, right? A little bit of chaos. Imagine if you're brand new. Let me pull this up. Imagine you're brand new. And they described it like this. Hey, here's our checklist for child and family team meetings. Okay, before the meeting, you're going to schedule the meeting with the family and all key team members. You're going to secure a comfortable, neutral meeting space. You're going to prepare an agenda and any necessary documents. You're going to remind all attendees of the time and the place. At the beginning of the meeting, you're going to welcome everyone and do introductions. You're going to review the purpose of the meeting and the ground rules. You're going to start with strengths, what's working for the family. And then you have a discussion phase. Maybe the family shares current concerns and goals. Each team member provides input on their role and supports. Identify strengths, needs, and available resources. Address conflicts or different viewpoints constructively. For action planning, you're going to define clear, achievable goals. Assign specific tasks to team members who does what. Write down all commitments and next steps. And then in the wrap up, you're going to summarize key takeaways and responsibilities, schedule the next meeting, and distribute notes and action plans to all the team members. So if you had something like that, it's not going to tell you, let's look at this, welcome everyone and do introductions. That can go poorly or that could go well. That's not going to tell you how to do that well, but it's going to make sure that it gets done, right? Define clear, achievable goals, same thing. So if you had something like this and this was in your, let's say you have an agenda for that meeting and you put this in your agenda and you're new, you're going to hit all of those things and make sure that you're doing all of those things, right? Especially before the meeting, after the meeting. So let's say you have remind all attendees of the time and the place, and your entire organization is doing that, maybe 24 hours advance notice. Hey, just want to remind you. Well, now you have consistency and you don't have, oh yeah, we didn't remind them because, whatever, and then, they didn't show up or something like that. So this is an example of a checklist. Where should you be using checklists to improve quality? Where can you use them? You could have an intake process checklist. You could have a child and family team meetings checklist. You could have a strength and needs checklist. So when you're doing a CANS, you have a checklist. You have a crisis planning checklist. You have a goal setting checklist, maybe. You have a progress monitoring checklist you could do. You could have a family transition and graduation checklist. You could have a staff supervision and training checklist. And you could have a documentation and compliance checklist. I use checklists all the time. I don't actively currently work with kids and families. I work on software engineering products, um, projects, and we use checklists for everything. Every time we're going to release a new feature, how do we do it safely? How do we not lose data? How do we inform people that it's happening? How do we have checklists for our data backup management systems, everything, and it makes sure that everything goes right and all the things that have to happen are happening every single time because it matters, right? If I go a month and I skip my backup verification on our database systems, and I don't know, we get hit with ransomware, it's a really, really, really bad thing if they say, hey, when was our last backup? Oh, well, the last one that works was from 4 months ago. And so we just lost 4 months of information, right? 4 months of documentation is gone. But if you make sure the important things always happen, they're going to happen, right? Very, very important and very easy. I mean, we're talking about something that just seems so simple. We're all in this training thinking like, well, yeah, checklists, like we've heard of that. They're not implemented nearly enough, and they can be a very, very inexpensive yet powerful way to boost your quality and something you want to boost the quality in. Usually, a checklist, you can gain like 30% in almost anything by implementing a checklist. And so it's an easy win, right? Doesn't fix all your problems, but an easy win. Um, how to use checklists. So how do we use checklists? They should be clear and concise. You don't want to make it a manual, like a user manual of how to do something. Clear and concise what has to happen, right? You need to customize them for your programming needs. One size does not fit all. I'm going to give you an example of a CANS checklist. That's me just writing up a CANS checklist of stuff. If I were to implement the CANS, what are the things that I think are important to make sure you get right every single time, right? It might be different for you. You might have different procedures. So I would tell anyone, never take someone else's checklist. If somebody has a good checklist, take it, make it your own for your program or your team or yourself. And but definitely don't think you can't customize them because one size does not fit all. You have to train on checklists. So people have to know this is the checklist, this is how you use it, this is what the items mean. You know, when we say follow up after the family team meeting and give everyone a copy of the notes. Well, what do we mean by that? Well, we mean within 24 hours or 48 hours or whatever it is your process is, but train to the checklist. Gain staff buy-in on the checklist as well. Everyone who's implementing the checklist should agree that those are all good things that should be happening. Nobody should think, hey, this item's on the checklist. That's so stupid. That's not important. Well, if they think it's not important, they're probably not going to do it. So just make sure you have alignment around everyone to say they're on here because they're important. And somebody says, well, that's not really important. Make that a conversation. And if it's not that important, take it off the checklist. If it is that important, make sure everybody understands why it's important, right? Sometimes people don't realize why certain things are important. Because of underlying theory of what it is you're doing. And so they're just seeing, well, we're doing this thing. What's the point of it, right? Why does it? I don't think it's important to start a meeting with talking about successes and what went well because there's more important things. And I think it's more important to just get into what's going on. Well, no, right? This is why we want to start with strengths and why we want to start with what's going well and celebrate, even a small success from the week and, break it down. So everybody should have buy-in on the checklist. Use the checklist for accountability. Again, to me, if I have a team and I say we're using this checklist and I'm supervising that team, it is not a question, it's a statement. We are using this checklist. This is the way we're going to do it. Again, let's talk about it. If there's anything that's impossible on here to do, we're going to talk about it. But we are all going to be accountable for this checklist. And the reason we're doing it is because these are such critical things that have to happen. I don't want to risk them not happening because I care too much about that family to leave it up to chance that something important is not going to happen. Because I don't want there to be any reason in the world why that family is not successful. So we are all going to use the checklist and we're all going to be accountable to it, right? It's not optional. And that just has to happen, right? If you're leading a team, everybody has their own, leadership style, make it your own. But the whole thing is going to be worthless if it's optional. So people should be accountable to the checklist. Document the checklist completion. So if you have a checklist, hey, here's our intake checklist, collect it. right? Hey, here's our intake checklist. I'm going to get that back. And we're looking at, hey, these things weren't done. How come they weren't done? Because there's going to be times where you have to deviate from it, right? Keep checklists flexible. There are going to be times where, you know what, in this case, I promise you, it was not a good idea to ask the specific question at that time. This is why. And it's okay to break the rules, right? So you have your checklist, but there is always going to be a potential valid reason, but it needs to be a valid reason where following the checklist would result in worse results than not following it, right? Right. So be keep the checklist flexible, right? And then definitely review and improve them over time. You should be looking at, if you are incorporating these checklists, you should be looking at it and saying, hey, are we still doing this? And everyone says, not really. And then we say, okay, should we be, or should we take it off the checklist, right? Or what do we need to add to this checklist, or things like that. Make sure you review them, make them a living, breathing document over time. I suggest at minimum every 6 months. If they're new checklists, I would do it every month and then move it to every quarter and then 6 months minimum. And maybe you could do it annually after a while if you think it's a good checklist. So that's how you would use them. So imagine what things would look like. So if you're implementing cans, which I think everybody is, what would things look like if you used a robust checklist for cans administration and implementation? And I'm gonna put over just this document that I wrote up. Can you guys see this Word file? Can I get a nod? Yes. Okay. So if you're using a checklist for cans, imagine how amazing your cans um, implementation would be if we had this checklist. This is brief. It's what is it? 3 pages, 2.5 pages. And we said, okay, we're going to do pre-assessment preparation. So we're going to review the referral and background information. And that's obtaining the relevant history, confirming the child's age, developmental level, any other special considerations, identifying key stakeholders, family, school providers to include in the discussions. And then I'm putting in here some common mistakes. I like to put those in there so that people see, hey, watch out for these things, right? So skipping this step and going straight into the assessment without context, very, very common mistake with cans. By the way, let me stop sharing for a second. I'm talking about cans, and cans can be almost like a religion to some people. And there's going to be different views on my checklist. So if you disagree with my implementation of cans, that's definitely okay. We all have, some things I think are objectively correct and incorrect. But if your approach to cans is different, uh, and you were to take a checklist like this, make it your own, I would say. So, but I've gotten into too many cans wars on nuanced things that I don't think matter too much. So let me share this again. Okay. Share screen one. Okay. That's always my cans disclaimer. And so then I'm going to say, okay, let's engage the child and the family. So you're going to explain the purpose of the cans in simple, non-technical terms. You're going to address concerns about confidentiality and how information is going to be used. You're going to build rapport. You're going to ensure the child and caregiver feel comfortable sharing. Common mistake, rushing into questions without first establishing trust. You're going to prepare the assessment materials. You're going to ensure you have the correct version of the CANS tool. You're going to have digital or paper sheets, scoring sheets ready. You're going to plan a comfortable, distraction-free environment for the assessment. Again, common mistake that happens using outdated CANS versions or incorrect scoring sheets, right? Now you're going to actually conduct the CANS. You're going to gather information from multiple sources. You're going to interview the child, the caregivers, other involved professionals. You're going to use observational data, and you're going to review existing reports if available. Again, common mistake, relying only on caregiver input or assuming past assessments are still accurate. Very, very common mistake. Only one source of information. You're going to rate the needs and strengths accurately. So you're using 0 to 3 scale consistently. You're being objective using evidence rather than personal impressions. You're clarifying ambiguous areas with follow-up questions. Again, common mistake, defaulting to middle scores without justifying them. Very common to say we feel comfortable in 1s and 2s because 0s and 3s are a little extreme, right? Identifying both strengths and needs, actively look for strengths, not just challenges, consider cultural factors that might affect responses or ratings. Again, common mistake, over focusing on deficits and missing strengths that can be leveraged. Document clear justifications for ratings. Very, very good practice in terms of this being because again, CAN's multifunctional. You can use it as assessment. You can also use it as a communication tool, as a planning tool. If you provide brief, specific examples for each rating, it makes the CANs like 10 times better. I promise you. Ensure the notes are concise but detailed enough for future reference, right? Common mistake, writing vague justifications, child struggles in school, instead of child has failing grades due to attention difficulties, right? So detailed without writing a whole paragraph. Post-assessment and action planning, right? A lot of people even miss this. Review and discuss results with the team. Ensure ratings align with the information gathered, discuss discrepancies, and resolve any rating conflicts. Again, common mistake, not double checking for inconsistencies. So for example, if a child's rated high for behavioral issues but low for risk-taking behavior. So check for inconsistencies. Use CANS data to develop an action plan. So link the identified needs to targeted services and interventions. Use strengths as protective factors in the plans. Again, common mistake, completing the assessment but failing to connect it to actual interventions, right? You do the assessment and then you go and you put it in the kid's file and you say, hey, we're compliant. We did the CANS. Let's now pretend like it doesn't exist and do something else, right? You should be sharing and explaining the findings with the family, present results in a family-friendly language, discuss next steps, and get family input on the plan. Again, common mistake, handing over the results without explaining what they mean. Hey, here's your CANs. Or maybe not even sharing the CANs, right? Make it a opportunity for discussion. You're going to ensure proper documentation and follow-up. Submit the completed assessment to case file. Set a review date for reassessment. So for example, every 6 months or however often you do it. Again, common mistake, forgetting to reassess over time. So now you have outdated data that it's not even reflects the child's needs anymore. And then a final step, I put this in here, final quality check. Have another professional review the assessment for accuracy. Super helpful. Double check for bias or assumptions in your scoring. Really, we can all help each other with that. Ensure ratings are consistent across domains. Confirm that assessment results inform service planning. So have a buddy look at it. Have your supervisor look at it. Have a peer look at it. So imagine if we had this checklist and everybody was using it when they did the cans, your cans process would be about 10 times better because you're hitting all of these areas that I didn't put anything, I don't think that's outside of like, if you look at the cans manual, right? But a lot of times we get set in these things where we say, okay, we're doing our cans. All right, we did it. It's a compliance thing. We're required to do it. And, state of California has this requirement now. They want cans for everybody. Well, okay, if you're going to do it, how do you actually do it and use it as a quality improvement tool to make kids' lives better, right? How do you actually do it? And you can even use it as an outcome measure because you can use it as a planning tool. You can also use it as an outcome measure for those kids. So that would be an example of a checklist for cans. Okay. And yeah, any document I'm showing is my treat to all of you, and I will free of charge. The cans checklist is $12.99, and you can just I'm just kidding. I'll get that all to you, and you guys can get copies of anything that I'm doing. I have them in like Word files, so you can modify it and do whatever you want with it. Okay. All right. So let me share again. All right. So again, imagine what things would look like if you used a robust checklist for CANs administration and implementation. You should do it. Okay, fidelity measures. I talked briefly about these. There's the WIFI-EZ. It's a survey that goes to the care coordinator, the youth, and the caregiver. There's also a team member version. There's the TOM 2.0. This means trained observers are observing a child and family team meeting. And you have the DART, which you're reviewing the actual case file. These are all released by University of Washington. Their WORT team, Wraparound Evaluations and Review Team. Something like that. I get a lot of acronyms wrong, but they're an amazing group. They're the ones partnering with CDSS for the Wraparound Data Pilot. These are 3 of the measurement tools they use. They provide their own training on things like that, so we're not going to get super deep into these other than me endorsing them as just excellent measures of fidelity. They're fairly easy to do. The DART, people complain about it. I complain about it. It just takes time. It's very good. So as much time as it takes, I'm going to say it's very good. They've done an incredible job developing these measures. And if you are participating in the pilot program, you can actually use these for free. And so the state is picking up the cost of these measures. And there's a whole online system where you can put your data in and you can look at it and run samples and say, okay, I want to sample 20% of my youth that I work with and get those in there. I'm sharing this with you because sometimes you think, well, how do I measure these things, right? How do I know that natural supports aren't really being included. How do I measure that? These will measure that for you. All three of them will measure it for you. Together, it measures it even better because the WIFI is asking people about natural supports. The TOM is in the child and family team meeting. Are those natural supports there and participating? And then the DART is are the natural supports included in the plan of care? So it kind of hits it from every angle. So I highly, highly endorse these. Some people say like, "Oh wow, are you getting paid, Tyler, to hawk these Whiffies and Toms and Darts?" No, but I am a big fan. I think University of Washington has done an excellent job with these things. And so again, if you are going through this general CQI approach where you're establishing outcome measures, you can do that with the your outcome measure could be a measure of fidelity, right? Inclusion of natural supports. What's our baseline? Well, those measures would allow you to measure your baseline. You implement those measures, you're going to get a percentage of 0 to 100. So we're at a score of 20 or 80 or 90 or 50, right? So it's really easy to establish a baseline and then you can set a target. I recommend, especially if you're starting out, 5% over 3 months. So try to increase it by 5% over 3 months. You think 5% is not that much? If you go beyond 5%, great, but set realistic goals because it's fun to have a win. So say, okay, 20% of our youth have natural supports. Let's try to get it up to 25% over the next 3 months. Very, very doable. Okay. Again, identifying interventions. There's a lot of interventions you can do that we didn't talk about. The two we talked about today would be training. So maybe training can help solve the problem. Maybe checklists can help solve the problem. Maybe it's something else, right? There's all kinds of things you can do. The only thing I would say with the interventions is make sure they're measurable. So if you have an intervention, make sure that you can measure it because when you execute it, you need to know, did we just say we were going to do this or did we actually do it? And you're going to review your results, okay? So that's the general CQI approach that we talked about. Couple things. I'm going to show you this picture, okay? CQI is fun. Yes, it is. Go easy at first. If with CQI comes a level of accountability. If this is your break room at work after you leave this meeting, because I've got you so excited about CQI, chill out a little bit, right? Because it's a big change for people, and it's a good change. My experience is people really like it over time. But if all of a sudden you say, "Hey, I'm going to be measuring your performance on this, this, and this," even if you don't say you're measuring people's performance, people are going to feel that, right? Well, you're measuring how well I implement the wraparound model because you're giving surveys to people and things like that, right? So, excuse me, you're never it's not going to go well if people aren't excited and it's not implemented with, again, to me, we do it because the outcomes of the kids matter. That's my number one concern is I want the trajectory of these kids and the families that we work with to be better. That's why I care about CQI. I also, at the same time, I want a environment for all of our staff that's safe, that feels safe, and that is enjoyable because the job is hard. So the job's a hard by itself. So if you add in, hey, here's your metrics and let me talk about your numbers and all these things, people are either going to leave or they're going to be miserable. So ease people into it. Talk about why we like quality improvement. If you feel like you have a bunch of people who are going to be like, we don't want anything to do with this, send them to a UC Davis training on quality improvement, and hopefully we can get them bought into it because once people I think make the connection that yeah, the reason we're doing this is because it's too important not to do. It's too important with these kids' lives that we're working with not to do these things and not to get better and better and better and strive. You're never going to be perfect, by the way, but strive to that perfection, like commercial airlines, right? By the way, commercial airlines, what I was talking about was perfection in safety or almost perfection in safety. In terms of like customer service, a lot of times they get like a big F, right? They need some CQI in customer service sometimes. But safety, we're talking about safety, right? Which again, if I could take customer service or safety, I would take safety, right? So, but they could do both, they just don't. So, so my advice is don't get too zealous and want to do everything all at once. ease people into it. I'm gonna break for questions in just a second, but I want to do a quick plug. There is the statewide conference for CQI. It's in Sacramento, March 25th to 27th. I'm doing a workshop, not on CQI actually, but on data. So right now this is subject to change, but it's March 25th, 10:50 to 12:05 p.m. So 10:50 a.m. on that first day of the conference. If you guys want to come, I'd love to have you guys in there. I'm talking about using AI to analyze unstructured confidential data. So what I was looking around, and AI is like this big thing, but the problem is if you drop something in a chat GPT that's confidential, you've just violated like 6 regulatory compliance rules, right? And so how do you use AI? AI can be used to analyze unstructured data. So that's what my workshop's going to be. How do you turn like incident reports, quarterly reports, and other qualitative documents into something that you can actually analyze and be in compliance with privacy rules? So we're going to show you how to kind of do that. So if you guys are interested in that, I'd love to have you. I just want to plug that really quick. And that puts me at this point, and I'm happy we have 20 minutes. Does anyone have questions? Or Danae, I don't know if there were questions in that I missed.
I had not seen any roll in the chat. There was fever in the chat around your checklist, the CANS checklist. I am a believer of checklists because I keep one myself just to stay organized in my daily life. So I know that your audience would absolutely appreciate that. So Tyler did say he was going to give us all a copy of that. Once we publish the recording of this website or of this webinar on our website, we will have the PDF version, the CANS checklist, and also the other checklists that Tyler shared attached to that. I was teamsing with my program coordinators while everybody was looking to see if there was another CQI and wraparound class available. Tyler doesn't know this yet, but we're going to be working with him to set up another class to be in tandem with the release of the next webinar. So that way, if you have others within your organizations or counties who are not able to be here today, they can view the webinar and then register for the class after. So we'll have that be corresponding for you all. I love that Olive Crest's data lead is also has a heart for youth and families. To see an entire organization aligned from frontline workers to administration, directors, supervisors, the person who answers the phone, and also when you have someone like Tyler coordinating the data within the organization, all aligned for youth and families. What a beautiful, beautiful thing to see. So I just wanted to uplift
Oh, thank you.
Tyler
Are my
and
cheeks red
Annabelle.
from that compliment?
Absolutely. Absolutely. So please, if you have any questions, now is the time. I invite you all into ask Tyler. Is there a list of consultants in California who are contracting with counties to walk them through the route? Yes. Sal, that was direct message, sorry. In the flight illustration, there were 3 components to make the flight successful training checklist. What was the third?
The third was planning. So ideally, when I was putting this together, I wanted to go through training checklists and planning, and then I had to pick 2 because I was going to run out of time and I didn't want to talk too fast about them. But planning. I can't tell you, it relates to checklists and training if you think about it, because checklists are a form of planning, but they're basically, when I talk about planning, is let's not assume everything's going to go well. Let's have a plan. And you do this with families. You have a safety plan, right? Or a crisis plan. You have a plan of care. So assume stuff will go wrong and won't go according to the main plan. Have that backup plan. Say, hey, what if this happens? What if Johnny does AWOL? What are we going to do? Are we going to say like, well, that was it, right? Or what if Johnny does get arrested? What are we going to do? Maybe you have the probation in on that plan, and we have a fallback so that it's not failure when something goes off track a little bit. You can get things back on track. Yeah, really, really good question. Yeah, there's a hand from Amy.
Yeah, thank you so much, Tyler. My name is Amy Bailey. I'm with CDSS, and I just wanted to say this was such a great training, and you actually made it sound fun. So I appreciate that. And I just wanted to mention, I'm going to put in the chat the California Wraparound standards. They're in draft form right now. they will be coming out with our letter when that comes out. And I know that's been delayed and people are waiting for that, but I wanted to mention the first two sections of the standards are the fidelity indicators, fidelity to the wraparound model, and then the expected outcome. So those will be the mandated California wraparound fidelity indicators and the outcomes. And of course, you can go beyond that with your CQI, but I wanted to make sure you all had that information to go on. Just putting that in the chat right now.
Oh,
And as I
excellent.
said, yeah, it's in draft form. So just wanted to mention that. But thank you. This was really great. Thank you so much.
Yeah, my pleasure. Other questions while we're here? Anything that I went over that was confusing, I can go back to it.
I also loved that you were giving an example, Tyler, of, being a newer staff and aligning data with their learning of their role within youth and families, and how that can be overwhelming, and to slow down, to speed up. I thought that was a very important point. And data's new, right? Not new for me, newer. And I like that you're sharing it in a way to where all of the roles and everyone, all the way down to our youth and families, can appreciate how data can help them be successful and sustainable in their own families. So I thought that was a really good point too. We are recording this training, and James, if you want to go ahead and drop the evaluation in the chat as well, so that will give our participants some time to fill out the evaluation. We do read these and we do take your feedback. So please fill out that evaluation. Again, this webinar is being recorded. Thank you, Tyler, for being here today. It takes a few weeks for our recordings to end up showing up on our website. But along with the recording, we will have the PDF version of Tyler's presentation. I did drop it in the chat. I'll drop it again in just a moment. Both of those checklists, and we'll send out a corresponding email to let you know when those are available. And you'll also see a class on there that you can register for CQI and Wraparound with Tyler. So those will be coming up, and look out for those. Right.
Oh, Beatrice, you meant the training in Sacramento. It will not be recorded. I can almost guarantee you. But come in person. I think they feed you there too. So like if there's no other reason to go, it's a free conference and you get fed. That's the only one I've ever seen that
That
does
feeds
that.
you. Well, we at the Partnership Wellbeing Institute, we also feed you.
You do, but you have to pay to go to that.
Yeah, it's true. All right, got me there.
Yeah, but that's another good one. I think Partnership is my favorite one for Wraparound for sure. It's like I think because it's every other year too, that makes it like, oh yeah, we're doing this again. Yeah,
Absolutely.
Emily, you had a question?
Yeah, thank you. This is a really good training. Thank you for this. I had a question about what your experience is with like smaller teams that don't necessarily have training programs when you're trying to establish baseline or start that measurement. If
Yeah.
all of our trainings are sort of outsourced, where would you start with that if nothing's in-house?
Yeah. So that's actually a great question. So if it's not in-house, how do you do that if you're still trying to follow that model where you measure reaction, learning, behavior, and results? Still measure it. So you send someone to a training. Let's say they go to a train with UC Davis on safety planning, right? They go to that after. You should check in with them and say, hey, everyone who went there, let's have a conversation about it. And you can still measure it. Even if you have a team of like 2 people, this is not an expensive endeavor to do something like the Kirkpatrick model. So you can say, did you find it useful? Did you like it? And then what did you learn, right? And try to figure out what if they learned anything. And then you can also measure whether or not they're actually implementing what they learned. It's a lot easier if you are in, let's say you're in the leadership role, if you attend that same training would be better because now you can you can better understand what it is you would expect they would have learned or not learned, because you can send someone, I've been to trainings where I think I'm going to learn about, okay, we're going to teach you about, I don't know, compliance with hiring practices or tax issues or something like that. And I'm in the training, I'm like, well, the title was a little misleading, right? So it's helpful if you can be in that training that is outsourced, whether it's through anything really, but you can still do those things. And I would highly encourage you to still do those. Yeah.
Okay, thank you.
I love that. The neuroscience of wraparound. So good.
I'm also putting the link in the chat for our email list. So if you are not on our email list to receive that update once the recording is live on our website, along with those 2 tools and the PDF version and announcing Tyler's CQI and wraparound class, I did post it in the chat here. If you need a PDF version, I can post it again. It's in the chat. And with that, once you fill out our evaluation for today, I just want to say, Tyler, thank you so very much. I'm with Amy Bailey. The first time I heard Tyler talk about data, I was like, wow, I absolutely understand and picking up what you're putting down. I've never had that experience before. So Tyler, not
Good.
only are you just a wealth of knowledge, but your way of instruction and talking about data is pretty incredible. So we're really grateful to have you here today. So big thank you. Thank you again to James and our partners at the Family Center Practice Unit, Amy Bailey, Danny Gabry, Chris Petty, Kayla Granderson, and Janine LeSueur. We couldn't do the wraparound work without CDSS's partnership. So we're really grateful for that. Our next webinar will be next month with Jay Vermillion and wraparound roles. So look out for that. We were so happy to have you today, and we will see you next month, and I'll see you in the sandbox.